Good morning, guys. I hope we're all sparkly. C-dip done, gym session, run the dogs. It's been a good start to my Sunday. What's next? Does it matter? Because I'm living in the moment. Will you live in the moment to make your future a more positive experience? And it's about experiences. It's about sharing experiences and sharing perspectives. So I love my C-dip on a Sunday. Is it different from my 2-degree ice bath every morning? Yes, because the sea throws up its own challenges. Is it going to be tranquil? Is it going to be stormy and wavy? Is the wind going to be blowing through my hair? Oh, if only I had hair. But it's always a unique experience, and I absolutely love it. And I wouldn't change it for the world. I went to the gym. What did we do at the gym today? Well, it was push-pull, but mainly chest. I saw a patient and we exchanged pleasantries. And I said, "How are you?" And he said, "It's the best day of his life." Not because something unique has happened, but because every day is the best day of his life. Because he has the right perspective. Even facing hardship and adversity, he sees the positives. And it's partly due to testosterone replacement therapy, but it's also partly due to mindset. Well, mainly due to mindset, but the testosterone allows him to see things as challenges and opportunities, not threats. And we talk about this a lot, don't we? Because it's super important, because you can still decide to see the glass as half empty, not glass half full. It's ultimately down to you, but the testosterone forms the foundation, and TRT is the catalyst for change, for ultimately you to take personal responsibility and accountability for your actions. So yeah, good gym session, got a good pump. And I've just run the dogs. Now again, my dogs live in the moment. They are fully engaged in the moment. And that's a key to success when it comes to mindset. The past is the past, the future is the future, but living in the moment. So what happened on our dog run? Well, we had a wonderful time, obviously, because we always do. But we also came across a couple with 2 yappy dogs. So my first comment is, are your dogs okay? She said, my dogs are okay, but I'm petrified of German Shepherds. Now, okay, so German Shepherds get a bad rap. And it's unfair, obviously, because every dog is a unique individual. And it's the owners, not the dogs. But they can be a bit feisty. So I put them both on the lead. Her dog started yapping. So my dog started yapping. I say barking because they don't yap, they bark. So obviously she's going to walk away from that experience and go, "Oh, I don't like German Shepherds." But what was happening? Well, her anxiety, her angst with regards to German Shepherds, and all German Shepherds are bad, meant that she was anxious, which made her dogs what? Anxious, which made my dogs what? Anxious. So they react to their emotions because they don't understand emotions. There are no emotions. They respond to instincts. And this woman's emotions clouded the picture. So she's going to walk away from this experience again with a negative experience, not understanding that her anxiety created her dog's anxiety, which then made my dogs react, as they would do. But it was no harm done, and we walked on and we had a lovely walk again. So, being a doctor is a wonderful job or vocation. We learn a lot about disease, about prevention, but we also learn a lot about human psychology. Now, in my time as a GP, I've dealt with a lot of patients with dementia. Now, we know low testosterone and low estradiol is going to be causative to dementia. So don't let your levels decline. Keep healthy levels because you want a healthy physiology to maintain a good, healthy psychology, to hopefully have positive emotions. But again, you're in charge. So I had a technique for dealing with demented patients. And it comes from Cesar Millan, the dog trainer, the dog whisperer. It's calm assertiveness. Now, because these poor people have lost their memories, they are constantly reacting to a new situation, not appreciating what's happened before. And that ultimately leads to anxiety and sometimes anger, because if you don't know what's happened before and you're suddenly faced with a situation that's unusual, unexpected, your knee-jerk reaction is not going to be calmness and love, because again, what are we supposed to be doing? We're supposed to be surviving. So you're going to react aggressively or anxiously. So what's my role as a doctor in this situation? It's to be calm and assertive. It's to understand the situation that I'm faced with and react appropriately to hopefully make it a positive experience. So rather than going, oh, you're supposed to be calm and assertive. And again, testosterone is the calming hormone, and it allows you to be calm and assertive, because again, our role as men is to do what? Be leaders. Now, does that mean you have to be in charge of everything, or can you follow? I mean leading by example. So again, super important to have the right perspective, and super important to understand your role as a man is to lead by example. So again, psychology, super important for manipulating your physiology, and super important for those two to manipulate your emotions. And again, allow your emotions to be true by living more according to your physiology and understanding your psychology. Let this dictate your emotions. And we talk about moving forwards. We talk about the need for movement. And that's not just physical movement. That's also progressive movement in your brain. So the patients that really struggle on TRT, they don't see this as a last chance. They see this as another chance. Now, it's not the last chance, but it's likely that a culmination of things have led you to low testosterone. A culmination of things that you need to address on a daily basis. And one of those really important things is mindset. So if your mindset is glass half empty, what can you do for me, not what you do for me to help me help myself. So again, we're not looking to have this paternalistic relationship with the doctor. How can you help me help myself? And again, sometimes you get a bad hand. How are you going to play that hand? Now, we see in cancer patients with a positive mental attitude do better with the cancer patients with a negative attitude. So you've got low testosterone, boo-hoo. Okay, what are you going to do with that? Is your self-pity helping you? No, it's not, is it? So it's about changing mindset and taking personal responsibility, as we said. And the accountability is ultimately down to you. So you want to be an example to who? Yourself and to others, as we're all mirrors. So what are you going to do? Get on with it and earn your reward.